New robotic surgical technology at CHI Health St. Elizabeth now allows surgeons to uniquely tailor knee and hip implants to each patient. Joining us today is Dr. Lee, an independent orthopedic surgeon performing surgery at St. Elizabeth. Dr. Lee, thank you so much for being here.
No, thank you. Thank you for having me today.
So please tell us about this robot.
Yeah, so I think that the robot is a very exciting additional tool for the joint replacement surgeon. As a hip and knee replacement specialist, I'm constantly striving to optimize results and outcomes for my patients, and the robot just represents yet another tool to help facilitate that means. So, with the robot and its 3D modeling software, I'm able to preoperatively determine the optimal implant sizes and predict the effects of altering implant positioning and alignment on the all-important post-op parameters of joint range of motion, joint stability, ligament balance, and leg length. So once I formulated the definitive surgical plan based on the information from the robot, then I'm able to execute that plan in the operating room with a higher degree of precision than I can often do with manual instrumentation techniques.
Wow. So how does the experience for the patient then?
Yeah, so I think people need to understand that everybody's anatomy is unique and the deformity from the arthritis is unique. So with traditional manual techniques, we're basing our cuts and our surgery on anatomic averages based on population data. With the robot, we're able to now uniquely tailor the surgical treatment for the patient, taking into account their anatomic variables and also the changes in their deformity from the arthritis. And that results in improved kinematics of the joint, improved joint stability and balance and function, and ultimately, hopefully, improved longevity of the components.
Wow. What kinds of joint replacements can the new technology be used for?
Yeah, so currently we're utilizing the robot for doing primary direct anterior approach total hip replacements as well as primary total knees, but there are many exciting additional applications in the pipeline, which I'm sure you'll hear about.
Awesome. Does the robot actually perform the surgery?
Well, I'm glad to report that I still have a job and I don't envisage being replaced by a robot anytime soon. So the robot, as I say, is a tool for the surgeon to optimize the outcomes for the patient. I'm in the operating room performing the surgery as I would with manual instrumentation. The robot is just a tool to assist me to do my job better, as it were.
Yeah. Did you ever think that in your career you'd be working with a robot?
You know, I guess it's just like semi-autonomous driving vehicles. It still requires the driver to be awake and alert, eyes on the road, hands on the steering wheel, but the technology helps you to drive better and more safely. And so, who knows about who knows about technology? I didn't think I'd be carrying around an iPhone and doing everything I do with it, 20 years ago. So.
Yeah, awesome. Is there anything else that you'd like to let the community know about the robot?
No, I think that, as I say, it's a very exciting development. It's a powerful additional tool, but I think it behooves the patient to seek the counsel of an experienced joint replacement surgeon who, as I say, I still have a job.
All right, Dr. Lee, thank you so much for
being
here.
No, thank you for having me. Merry Christmas.